Let's continue where we left off last time. Last time we were discussing neuronal circuits. I noticed that towards the end I was losing a lot of you. So we're going to basically do a little bit of a refresher on some of the stuff that we closed out on last time. So we talked about four major things that come into play when you're developing neuronal circuits, right? You have chemoattractants. Those are also referred to as tropic signals. So when you hear tropism, don't confuse that with trophism, right? So if you hear a trophic signal, trophic means that it's something that is required to provide support and nutritional growth, nutritional support for the developing neuron in this case, right? So neurotrophic factors are going to be signals that are really important to basically allow the neuron to stay alive, whereas a tropic signal just basically tells the neuron where to grow, right? So it guides the direction of the axonal growth cone. That's basically what those do, right? Versus trophic signals are going to be important for the cell's survival. If you remove trophic signals altogether, those cells can die. For example, we're going to talk about a couple of studies that have been done on chick embryos where they remove a limb, for example, and in the spinal cord, the regions that correspond to developing neurons for that particular limb atrophy and go away, right? So if you don't have a limb during embryogenesis, you're not going to have the neurons growing in those areas. So BDNF, NF, so BDNF is brain-derived neurotrophic factor. Those types of chemical signals that are trophic signals are extremely important to allow the survival of developing cells. Then you have your adhesive cues, and adhesive cues basically allow for cellular adhesion. So if you're like growing a neuronal bundle of tracts, for example, then you would allow those axons to adhere together so you can form a tract, for example. And then you also have chemorepellent signals as well. We're going to talk about the importance of chemorepellents as well as the signals involved in that, so that you don't have all of a sudden a bunch of axons or dendrites clumping up. Because if you don't have chemorepellent signals, neurons and neurites, which are all the extensions off of a neuron, they're all going to clump up together. And so we'll talk about DESCAM, which is something that is involved in cellular adhesion, which is allowing for chemorepellent. If you have any mutations on those types of chemorepellents, you're going to get clumping up of neurites. So we'll discuss that in a little bit. So here's an example of a chemoattractant. So netrin is going to be something that's providing chemoattractant signals. And so if you have netrins, then you're going to see neurons forming neurites that are going to be attracted to those netrins. So here's an example of like the dorsal part of a spinal cord. And then you have a bunch of cells here that are actually secreting netrins. And then you have neurites basically projecting out so that they can try to make connections with those chemoattractants. And then I think this is kind of where we closed last time. But we were talking about chemotropic signals that allow for crossing over the midline, chemoattractant signals that basically prevent crossing over the midline. So there's different types of chemicals that come into play that basically guide the ability for neurites to be put in the right direction, basically. So SLIT and ROBO are going to be a couple examples of that. SLIT basically prevents crossing over the midline, and then ROBO prevents crossing again over the midline. And so if you have any mutations on that, then you're going to have issues with developing, for example, the spinal column or the spinal cord. So here are a couple of those chemoattractant signals. So you have netrins that are going to be binding to different receptors like DCC receptor, the UNC5 receptor, SLIT that's going to bind to the ROBO receptor. And effectively these allow for proper direction of the developing neurites. And so they're going to basically activate actin. And remember actin, we discussed filopodia, lamellopodia last time. So the filopodia, those are like those finger-like projections, those are all containing actin. And so actin is going to be building out, it's going to be retracting, right? It's going to allow for movement of the neuronal growth cone. Semaphorin and sonic hedgehog and WNTS. So somathrins are going to be chemorepulsive, and so they basically repel the neuron from growing in a certain direction, versus sonic hedgehog and WNTS, those are going to be both chemoattractants and chemorepulsive. And so remember, with sonic hedgehog, there's certain mutations to sonic hedgehog that can cause all sorts of issues with the way that cells migrate in the brain. So if you remember, like holoprosencephalon, for example, is going to be involving a mutation of sonic hedgehog. So here's your somathrine ligand. So again, these are repulsive chemorepellents, and so they basically modulate the ability for neurites to grow in different directions, right? So they're going to repel neurite growth. And there's a couple different types. There's plexins and neuropilins. Don't get too bogged down with a lot of these different subtypes of chemoattractants and chemorepellents. These are just a couple of them that are discussed in your textbook. So, what's important? Calcium is really important in this whole process. So you remember last time we were talking about the importance of calcium. Calcium is going to be involved in lots of different neuronal growth patterns, patterning, movement, and all that, right? So calcium is going to be serving as a second messenger, and it's basically going to be really important for chemorepellents to also function properly. And then we're going to discuss tyrosine kinase. And I'm not going to make you guys remember all the different types, right? There's tyrosine kinase A, B, C, and there's going to be different neurotrophic factors that come into play on each of these different types of tyrosine kinase receptors. But just know that tyrosine kinase is going to be really important in cellular signaling for neuronal growth as well. Cell adhesion molecules, or CAMs, those basically are what allow for adhesion of the components of the cell. Those are going to be associated with tyrosine kinase receptors. And there's a couple different types of tyrosine kinase receptors. Again, I mentioned like A, B, C. There's also efferents and F receptors. Those are basically also tyrosine kinase receptors as well. And what do tyrosine kinase receptors do? Basically, when they get activated, they dimerize, and then what they allow to do is transferring of phosphate groups. And so they're taking the phosphate group from ATP and basically allowing for turning on and turning off of different intracellular signaling pathways. We're not going to go into full detail about all the different signaling pathways, but that's kind of the overview of what these kinds of receptors actually do. So here are some examples of your cell adhesion molecules. So first of all, you have your extracellular matrix, right? In your extracellular matrix, you're going to find all sorts of stuff. You're going to find things like collagen fibers. You can also find things like fibronectin, laminin. Those are all different components that you find outside of a cell. And those are going to allow for basically scaffolding. Right? Cells are going to be able to guide themselves using extracellular matrix. And so some of these different types of molecules are going to interact with the extracellular matrix. You also have integrins, right? Those are going to be they basically transduce signaling pathways. Again, they involve things like calcium as a second messenger. Then you also have, again, your cellular adhesion molecules. Basically, they are also going to involve tyrosine kinase receptor activation. So it allows for different types of changes within the cell. Actin, for example, it can help to restructure actin and cause different types of cytoskeletal changes. By the way, when we use the term homophilic, so to clarify, homophilic, whenever you see something homophilic, that means it's only going to react with one single antigen. And so here are some more examples. So you got your efferents ligand, which binds to the F receptor. That's also going to be a tyrosine kinase, causing downstream signaling, changing of shape of the actin filaments to allow for cells to move properly. There's also going to be certain genes involved in this whole process. So the ZIC gene, or ZIC2 gene, that's going to help with regulating the ability for cells to adhere and to migrate properly. And some of these other genes, like KLF, remember we talked about KLF before as being something that helps with inducing pluripotent cells. Remember we talked about those 4 major factors that come into play. So KLF was one of those. We also had OCT as well as CMYC. So those are all different types of genes that are going to be involved in guidance of the axons. And then if you had disorders of any of these genes, or cell adhesion molecules, for example, and the ability for cells to migrate properly, you could detect that using tractograms. So those diffusion tensor imaging technologies, where you basically use an MRI and then you put it through an algorithm to help light up all the different tracts so you can see exactly where the tracts are going. So if you had any sort of issues with these types of genes, you're going to have issues with the ability for example, allowing for certain tracts to decussate to the contralateral side, right? So if you had, for example, any sort of issue with the corpus callosum and genes that affect the development of the corpus callosum, which allows for communication between both hemispheres, that's going to, you'll be able to see that on a tractogram. So here are a couple of photographs and imaging from your textbook that basically discuss and demonstrate those issues. So for example, here's your cortical spinal tract. If you had any sort of damage to the genes that affect the ability for the nerves to move and grow in certain directions, then you would be able to see that. So in the cortical spinal tract, remember, we have like the lateral cortical spinal tract has to decussate at the level of the pyramids. So if you don't have those genes functioning properly, then you're not going to get decussation. So in other words, all those fibers remain on the ipsilateral side, as you can see over here. So they're all basically going exactly the same direction, ipsilaterally. No decussation across to the contralateral side. And so that was, here's some scans that show different brain regions lighting up when you're trying to stimulate those different tracts, and the different brain regions aren't really operating properly. So, for example, with this over here, on E, you're getting fMRI scan of a person trying to maybe move their arm, and you're getting all sorts of confused signals from the brain because the cells that were supposed to migrate that maybe, are responsible for the right side of the body, you would get left hemispheric activation. Both hemispheres are going to start to activate at the same time because it's all confused. So the signals aren't operating properly. Now, we talked about adhesion. So there's going to be signals that help to promote and to inhibit adhesion. We talked about guidance, right? There's going to be things that help to promote guidance. We talked a little bit about somatoforins, and those allow for repulsion. Those are going to be repulsive signals. And they're all going to be really important for different parts of the brain as they develop. So the retina, for example, they're going to have repulsive signals come in so that you can have, stratification. They call it tiling as well. So when you tile, you have different, distinct regions and layers of neurons. You'll see that within the retina. You'll see that within the cerebral cortex. You'll see that within the cerebellum as well. So these types of somatoforine signals are very important to allow for neurite growth, but also for stacking of the different layers and tiling. So here's a couple images showing dendritic branching. So Purkinje cells, you find Purkinje cells within the cerebellum, and here's basically the growth, a progressive growth of those Purkinje cells. You can see like neurite formation. You can see neurites kind of like vanishing if they're not establishing any sort of strong connections. So you get transient branches coming off of these cells as well. So they're constantly trying to establish connections. And we're going to talk about synaptic pruning, right? You don't want to have too many connections. Like when a person is born, like an infant, they're going to have tons of connections in their brain. And they're going to be constantly forming new connections as they're developing in their adolescence. But you don't want to maintain all those connections. Otherwise, you're like overwiring the brain. So you need to, over time, have synaptic pruning, where you maintain strong connections, and those connections are the ones that survive, and the weak ones are the ones that are eventually going to be removed. So if you were to look at cells growing underneath the microscope, over time, you're going to see, neurites form, you're going to see neurites retract and vanish, right? That's all the process of synaptic pruning. So let's now talk a little bit about tiling. Again, tiling is basically the way to allow for creating distinct regions within different cell layers, right? So you have to have tiling so that you don't have overcrowding, you don't have overclumping of neurites and things like that. So it's an extremely important process to allow for neurons to remain distinct from each other, right? Otherwise, they're all going to start to clump. So tiling is going to be also involved in dual repulsion. So neurons are going to repel each other sometimes, right? So they can create their own space. You don't want somebody getting into your personal bubble, right? That's kind of also what's going on with cells. Neurons don't want too much overcrowding. Otherwise, it's going to inhibit their way of functioning. So one thing that's really important in this whole tiling process is DESCAM, and that's going to be the Down syndrome cell adhesion molecule. And so DESCAM, if you had a DESCAM mutation, you're going to have clumping of cells. The neurites are going to start to all clump up together. So you have DESCAM1, DESCAM2. So this might show up on your exam, DESCAM, so make sure you know what DESCAM does. So if you have a mutation in DESCAM, then you're going to have neurons and processes evading each other's space, and they're all going to start to overcrowd, and they're going to grow on top of each other. So that's why DESCAM is so important. If you had a mutation to that, then you're going to have overcrowding. I imagine that it's probably, it was discovered in Down syndrome patients. So I don't know the full history of the DESCAM genes, but I imagine that, part of Down syndrome is cognitive dysfunction, to varying degrees. Some patients with Down, or some individuals rather, with Down syndrome function pretty normally, whereas with severe cases of Down syndrome, those individuals tend to be a little bit more like cognitively disabled. So this could be like the underlying process of some of the cognitive disability. So a lot of times things are named after what they do. So like in Drosophila, there's like the wingless gene, right? It's like they knocked out that gene and now the Drosophila gets born without wings, right? So genes are often going to be named after the disease that they cause, or like the things that they contribute to in terms of like structures. Right? And so this is kind of like the going from the gene, the genome, to the RNA, to the different proteins involved. There's going to be immunoglobulins involved in this as well. So this is kind of a breakdown. It's not super high yield, but this is high yield. So this stuff is important. So make sure you know what it looks like when you have a normal wild type cell with properly functioning DESCAM genes, right, versus cells that might have a mutation in those DESCAM genes. So they're all going to be starting to get clumped up together. There's also self-avoidance mutations. So they not only clump up together in groups, but they sometimes clump up on themselves, right? So all their dendrites get all basically stuck together. They don't have proper repulsive signals. Protocadherins. So there's cadherins and there's protocadherins. Basically, they're going to be really important for attachment of synapses. That's what cadherins do. Protocadherins are also going to be doing something similar. They can help discriminate from themselves from other cells. So it basically helps as a discrimination type function. And they can also help to modify axons as the axons are developing. So protocadherins play a really important role as well in tiling, as well as in the ability for the cell to recognize self versus other. So here's tiling and protocadherins. If you have a deletion of protocadherins, you might have neurons, not basically tiling properly. So they're not going to scaffold properly. They're not going to form different layers properly. So here's an example of the hippocampus. They're basically, in this example, they're looking at serotonergic type cells. So here's a normal hippocampus over here. So you have like a better distribution of those types of cells. Whereas if you have any sort of mutation in the protocadherins, then you're going to have inability for those cells to properly tile and to distribute throughout the hippocampus. So that's just an example of what you would see with those types of mutations. So let's do quizzes. There's two quizzes here. There's part 1 and part 2. We'll do part 1 here, and then we'll at least start part 2 so you can have access to that before Thursday. Oops, I didn't mean to start. So go ahead and log in. Let me see.
I wanted to show you two. Two of them are like the premium ones. The rest of them work, but two of the ones say like premium features.
Really? And you can't get access to it?
No.
Does anybody else have an issue accessing the premium quizzes questions? You did have issues? You can't get it at all?
Just like kind of like the game mode. Like I was able to read the questions, but the answers, but not.
So you can't answer it though. So you can see the questions and answers, but you can't see what the actual correct answer is. But do you get the? Does it tell you what the correct answer is? Yeah. It does. After class. It's like Quizlet basically afterwards. Yeah. You can't do the game mode. If you can show them how to access it.
I got them up too.
You figured it out?
At least which ones it is.
Okay. So maybe because I don't see what you guys see from my end, right? Because I created all these, but it would be especially useful if you guys show each other if you're having any issues, right? So if you could show them what you're doing. So if you have any issue, I'll try to resolve it. But I think there should be a workaround to it. All right, cool. Let's go ahead and begin. Looks like most of you guys got this correct. So kinesins go forward, dyneins go backwards, basically. I did read that sometimes there's a little bit of crossover with dyneins, but for the most part, big picture. Kinesins forward, dyneins backwards. So polarization is super important as the first steps of neuronal development. I think most of you guys got that correct as well. Nice, good, excellent. So yeah, neural polarization is the first step for circuit formation. So recall that neurite, that is any sort of extension that comes off of a neuron, could be the dendrites or the axons, and this one in particular is the axon, right? And one of the major differences between axons and dendrites, axons are longer. That's kind of like the main difference between the two. Good. Yeah. So those polarity scaffolding proteins. So it's going to be really important for polarity. And axons, that's going to be part of developing the cell polarity. So having long axons. Good. Microtubules, right? Microtubules are going to be super important for the ability for content, cargo to be taken to the distal end of the axon all the way back as well to the cell body of the neuron. And so microtubules, and they're very dynamic. They're constantly being formed, constantly being retracted and broken down. So lamellipodia, again, it's kind of similar to the webs of your fingers, right? Versus the filopodia, those are going to be the actual finger-like projections and extensions, all part of the neuronal growth cone. And this would be associated with axonal growth cone. As the axon is developing out, that's what you see, lamellipodia and filopodia. And the filopodia, think of it as just being actin, right? Not the microtubules. Whereas the lamellipodia contains both microtubules as well as actin. All right, good. Exactly. Calcium. Calcium is extremely important for a lot of these different signaling processes, right? And calcium, again, is going to act predominantly as a second messenger within these different types of pathways. All right, good. Yep, tropic signals, direction, whereas trophic signals basically providing the ability for the cells to survive, or the different components of the cells to survive. Now, with that being said, we'll talk a little bit about trophic signals. We're going to talk about those different trophic factors in the next part of this series here. So let me go ahead and end this. Make sure you finish the rest of these questions on your own time, maybe before Thursday, but I definitely want to at least complete the rest of this whole chapter. Any questions? Cool. So now let's talk about the way that synapses are actually going to be formed. And there's going to be a bunch of factors that come into play with synaptic formation. One of the main things that you have to have is synapses need to adhere to each other, right? So you're going to have things that allow for synaptic adherence, and then a bunch of other important things as well. So synaptic formation, you have to have affinity between the presynaptic terminal as well as the postsynaptic terminal. When we say presynaptic, that means the nerve that is sending the signal. Postsynaptic is the nerve that's receiving the signal. And so in order for there to be a synaptic formation, you have to have strong signals. Sometimes you have a synapse that gets formed, and it's not formed a strong signal, it's weak, and those synapses eventually get pruned back, right? So that, synaptic pruning also really important for proper brain function. If you don't get proper synaptic pruning, you basically overstimulate the brain. There's been some theories about how, like, for example, autism might work. Sometimes there's some theories are out there that say that maybe patients with autism have way too many synaptic connections. And so it basically kind of like short circuits the brain. It doesn't allow certain brain regions to communicate with each other. Also, you need to have the synapses attaching, right? So you have to have different types of adhesive factors. So your cadherins, protocadherins are going to be important in that. And then you have to have induction of synaptic formation. So some signals that help to induce this whole process to happen. Neurexins, one example. Neuroligands are another example as well. So we'll talk about those momentarily. So here's your cadherins and protocadherins. Again, very important for adhesion. And what else is important for this to happen? You have to have calcium being involved in this process. Calcium, again, is going to serve as a mediator to allow for cadherins and protocadherins to function. And this allows for things like, once you form a synapse, you're going to have things like synaptic vesicles coming into place. Right? Synaptic vesicles are what basically release different things into the synapse. So very important for allowing for neurons to communicate with each other. What else comes into play here? You have your cell adhesion molecules, right? So synaptic cell adhesion molecules. Again, also calcium dependent. We're going to talk about neurexins and neuroligands as well, but those are going to be really important to allow for induction of these types of processes to take place. And then epherin and the F receptor. So epherin is going to serve as the ligand. F or EPH is going to be the receptor. And so all those things are going to be important to allow for synapses to form. Neurexins, so some of these are going to be released by the presynaptic terminal. Some are going to be found in the postsynaptic terminal. The presynaptic terminal might contain, for example, neurexin. Neurligand or neuroligand is going to be on the postsynaptic terminal. Again, these are also really important in calcium signaling. So calcium, is going to be coming into play here with this whole process. And so these two things are going to be really important for retaining the cytoskeleton elements. So like actin filaments, for example. This is going to be modulating the cytoskeleton of the cell. Now, switching gears, talking about trophic interactions. Again, trophic interactions are really important for cell survival. If there's reduction in trophic signals, then the cells are not going to survive. For example, if you remove in an embryo, if you remove like a limb bud, like an arm or a leg, you're going to lose the trophic signals that were associated with that limb bud, and the neurons that were supposed to innervate those structures are going to effectively atrophy and die and not develop properly. And so here's an experiment basically talking about how if you remove a part of a limb bud or you actually transplant another limb bud to a region, you can either remove or atrophy the developing neurons associated with that limb, or you can actually create or regenerate the neurons that would have otherwise formed connections with that limb. So here's an amputation of the limb bud. So here's the developing spinal cord right here. You can see the different nerves that are going to be developing into like the motor neurons, right? If you remove that limb bud and you amputate it, those motor neurons are going to atrophy and they're not going to develop. Now, so here's from the missing limb, here's the normal part. Now, if you were to do a transplantation and you were to take that a limb bud from another embryo, for example, and transplant it onto a region on the developing fetus, that's going to basically regenerate the cells within the motor neurons, the region within the spinal cord that correspond to motor neurons. So you basically can re-stimulate those cells with a new limb bud. That limb bud is what contains the actual trophic factors. So here's another thing that's important in this process. So you have to have competitive interactions, right? Because cells are going to compete for connections. There's going to be certain cells that establish really nice, strong connections. That's often going to be guided by things like, the genetic signals, like Hox genes, for example, are going to come into play with allowing for, like partitioning and division of the developing embryo. There's also going to be those chemoattractant signals and also the trophic factors. So those neurons are going to be constantly forming new synapses, but not all of them are going to be strong. So you're going to get synaptic pruning. So synaptic preemptive removal is one thing that comes into play, which we'll talk about in a little bit. Then you have synaptic refinement. So you're refining those connections. Then you increase the specialization of the synapse. Now, if you preemptively remove a synapse, that's not basically eliminating. It's not actually like removing or reducing the number of synapses. You're just reestablishing connections. So you can remove the connection, but if you eliminate the connection, that is what actually reduces the total number of synaptic contacts. But preemptive removal doesn't mean that you're reducing the number of contacts. You're just basically restructuring and rewiring the brain. So different types of growth factors, trophic factors, all that stuff is going to come into play when you're having establishment of a synapse and the pruning back of a synapse. So different types of chemical signals come into play to allow for that to happen. So here's an example of the developing child. So you have postnatal, so the child was just born, right? Here's like a muscle that's going to have several different motor neurons attached to each of those different myofibrils. But with muscle groups, you're going to want to have each myofibril associated with a certain neuron. And so at first, they're going to have multiple different innervations, but then over time, a lot of those synapses and innervations kind of prune back. So they prune back, and now when you have a mature adult, now each of those muscle cells are going to have their own synaptic connection. Something similar can also happen within the brain too. So like when the cerebellum is developing, you're going to have tons of different connections, but they're all going to be pretty weak until you start focusing in on the strong connections and establishing a strong connection with those neurons. So basically kind of pruning back, but you're not having a net loss of synapses. Because if you look at the image here, in the diagram, it shows you, all these little tiny buds here, those are all synapses, basically. And now, but the thing is that the thing that's different is that you have fewer cells creating all those synapses. You have like one cell now creating multiple synapses on a muscle, on a neuron, for example, on a motor end plate, versus multiple neurons innervating the same muscle, right? So you get kind of like reorganizing and rewiring of those synapses. Here's another image of that. So these motor neurons are going to be attracted by the acetylcholine receptors on the muscle cell. And you have neurons that are not going to be super successful at establishing a synaptic connection. Those eventually are going to be pruned back. And so you can have more, like a selective innervation of those muscles as they're developing. And if you were to knock out the acetylcholine receptor, then you're going to affect the ability for the neuron to actually form a synapse. So it actually loses the connection. If you're losing function of a structure, you might also lose the ability for synaptic connection. Here again is an example of Purkinje cells. Purkinje cells are what you find within the cerebellum. As the Purkinje cells are developing, over time, as they mature, you're going to have one individual cell forming the majority of its connections, right? All the other cells that were previously forming weaker connections stop forming those connections, and now you're focusing on just one single type of connection. Here's another thing that's really important, so highlight that. The more dendrites a cell has, the more ability that cell is able to form synaptic connections. I mean, it's pretty obvious, right? It's very much intuitive. Right? The more dendrites, the more synaptic connections. So it's going to be one of the major guiding principles of synaptic formation. Again, if you have more dendritic geometry, it's more you have many more branches, then you're going to get more inputs in terms of numbers. So here's a graph that's kind of talking about what number of primary dendrites and number of innervating axons, and they correlate, basically. The more you have dendrites, the more you have axonal connections with those cells. Now, let's talk a little bit about trophic interactions. So again, remember, trophic factors are going to be really important for the survival of the cell. And there's going to be several different types of trophic factors. So here's one example, nerve growth factor, or NGF. There's BDNF, there's NF, which is neurotrophic factor. And so these different types of trophic factors allow for cells to form neurites. And so if you had no growth factors, the cell doesn't do anything. It just sits there, right? As soon as you start adding trophic factors to the cell, then it's going to start forming a lot of neurites, right? Trying to establish new connections in its environment. So super important. Let's see here. That's not super important. And here's an example. If you block those trophic factors, you're also not going to get any growth. So if you put in neuronal growth factor antiserum, which basically blocks the effects of NGF, then that cell is not going to form any sort of connections. It's not going to develop properly. Now, different types of cells are going to respond to different types of trophic factors. Now, don't even bother committing this to memory. You don't have to know, for example, which ones are associated with the sympathetic ganglia, which ones are associated with the nodose ganglia. Nodose ganglia, by the way, is associated with the vagus nerve, cranial nerve number 10. Don't worry about that because certain growth factors are not going to correspond with different regions of the brain. So, for example, the nodose ganglia, it does not respond to NGF. Okay, and the sympathetic ganglia does not respond to BDNF. Whereas in the dorsal root ganglia, every cell responds to all these different growth factors. So they can be a little bit selective in terms of which types of growth factor they respond to. But here are the major ones. So you have nerve growth factor, you have the brain-derived growth factor, BDNF, brain-derived neurotrophic factor, and neurotrophins, also referred to as NT. And again, there's selectivity in terms of which cells will respond to different types of growth factors. So developing hair follicle, you're going to have neurotrophic factor coming into play, or neurotrophin. BDNF is going to affect the Merkel cells. NGF is going to affect free nerve endings, which are sensory type of cells. Noxious cells, right? Cells that respond to noxious stimuli. So different cell types, respond to different types of trophic factors. And how do these trophic factors operate? They're going to be binding to tyrosine kinase receptors. Also P75 receptor, which is not a tyrosine kinase receptor. But in terms of tyrosine kinase receptors, these are some of the major kinds. You have, TRKA, tyrosine kinase B, tyrosine kinase C. There's also going to be the ability for one growth factor to, activate different receptors, because there's going to be similarity in the way that the receptors, are structured, right? So that you can have some cross-pollination between neurotrophic factors as well as the tyrosine kinase receptors. So like NT, for example, it's going to bind to the TRKB as well as the TRKC receptor. So it has a little bit of cross-pollination, cross-activation, right? And so they can be a little bit, promiscuous, I guess, would be the term for it. So you have cross-activation of these different types of trophic factors. But don't bog yourself down with remembering which tyrosine kinase receptor binds to which trophic factor. I know your textbook, some of the questions in your textbook are like, which ones bind to, tyrosine kinase B, tyrosine kinase A. I don't really care about that for the sake of this class. Just know that tyrosine kinase is going to be one of the major ways that these growth factors work. And when we talk about cross-activation, remember, homology is going to be what comes into play. So there's going to be some similarity between those receptors, right? They're very similar in their shape and structure. I mean, even like different isomers of like compounds, like drugs, for example, can bind to different types of receptors, right? So great example, like serotonergic receptors. There's like a ton of different serotonergic receptors, the 5-HT receptors, tons of different compounds can bind to those receptors because there's like cross-activation. They can cross-pollinate, basically. The P75 receptor is a low affinity receptor, so it's pretty weak, but it binds to all of them. It doesn't have any discrimination, but it binds to all of them. And what do these receptors do when they get activated? They do all sorts of stuff. Well, first of all, they allow for the neurites to grow. So here's an experiment in the Petri dish where they have set up wells that either do contain trophic factors or do not contain trophic factors. The wells that do contain trophic factors, you actually see growth of the neurites. But the moment you start removing trophic factors from a well, those neurites stop growing, right? It's not going to allow for the further development of those neurites. So in other words, removing of trophic factors reduces the survivability of the developing neurites. And what do the signals do? So when you have the trophic factors binding to the tyrosine kinase receptor, all that gets brought into the cell and it forms a signaling endosome. And that signaling endosome basically goes all the way back to the cell body to allow the cell to undergo all sorts of different things, right? It's going to help to synthesize proteins. It's going to help to allow for the cell to continue to grow and develop. So that's kind of what's going on. They get endocytosed into the cell, brought all the way back to the cell body, and it basically stimulates all sorts of different mechanisms within the cell for survival, for growth, etc. So you have to have retrograde transport with these signaling endosomes. They're going to basically move along the microtubule all the way back to the cell body and basically allow for transcription, translation of different proteins and whatnot. So here's a breakdown of what that looks like when you have a signaling endosome formed. So you have binding of the trophic factor to the tyrosine kinase receptor, and then all these different structures come into play. So it's, they all come into play to allow for transport back to the cell body. A little dining, right? So you got your transport protein bringing the vesicle back to the cell body. So this is what the different growth factors do. They do a bunch of different things. So they allow for cell survival. So you have cell survival is one thing, right? Also neurite growth, plasticity, right? We're going to talk about neuroplasticity in about a month or so, which is the ability for neurons to reform different connections, right? That's why if some patients get a stroke or something, and they can sometimes regain with physical therapy, they can sometimes regain the function of what was lost before, right? That's going to be due to neuroplasticity or the formation of new synapses. What else can you see? So with the P75 receptor, you see the similar things, cell growth and neurite growth, but also apoptosis, so cell death. So depending on what signals are being sent, sometimes you can actually induce apoptosis in the cell as well. Now, we talked about patterning, right, and developing pathways and tiling and all of that. And we've already discussed the homeobox genes, the Hox genes. Those are also going to be really important for specialization of regions of the nervous system, right? They're going to allow for certain regions of the nervous system to form synapses and connections with different parts of the body, different organs, maybe muscles, things like that. So the genetic signals are really what help to determine what kind of connections you're able to form. So here's some examples of different homeobox genes or the Hox genes and what they're eventually going to allow for in terms of connection, right? You have certain neurons that are going to innervate the diaphragm, right? That are going to form, for example, the phrenic nerve that allows you to breathe. Certain nerves are going to be associated with limb buds, right? So you need to have the limb bud present to provide the neurotrophic factors so that they can actually grow properly. Different types of muscle groups, the hypaxial muscle groups, the axial muscle groups, they're all going to have different specifications which are dictated by the Hox genes. So Hox genes extremely important for this whole entire process. Okay, moving on. So not only that, where you have like specialization of different tissues, but also the whole anterior-posterior differentiation, right? That's what AP stands for. AP stands for anterior-posterior. So it allows for cells to be matched with their target site, right? Their target organ, target tissues, etc. Now, let's talk briefly about chemoaffinity. So this is a theory developed by Sperry. So Dr. Sperry, so Sperry's chemoaffinity hypothesis. His idea is that positional labels are expressed in gradients across both the projection and target fields. Now, what does that mean? That means that you have, for example, cells are going to be moving in certain directions, right? And that's going to be chemoaffinity, right? Chemoaffinity means that it's going to be attracted to certain regions. So that's what chemoaffinity means. And it's going to be dictated by concentration gradients of different types of chemical signals, like neurotrophic factors, for example. Now, the experiment that was done to basically demonstrate the truth of this hypothesis, it was involving the retina of a frog. So we're going to talk about that in a second. So when a frog is developing, the retina is going to have different regions that are going to be associated with which tracts they move along. So with like the cells on the temporal side of the retina, those are going to remain ipsilateral, versus the cells that are in the nasal region of the retina are going to cross over and they're going to become contralateral. So you have different migratory patterns for the neurons, and they're going to be dictated by things like growth factors, etc. Here's a side note on what the tectum means, because we're going to talk about that in a second. The tectum is going to be part of the brainstem where you find the superior and inferior colliculi. I don't know if you guys remember those. The superior colliculi is associated with vision. Inferior colliculi is associated with sound. One thing that the superior colliculi also help to do is to help to basically invert images. So whenever we see, like we're actually seeing what your eyes perceive is the world basically upside down and inverted, right? Everything is upside down. But the brain has to figure out a way to cross that signal so that now reorients everything to its proper orientation. And so part of that is going to be dictated by the tectum. And that's going to involve also the superior colliculi. And so part of this study was removal of portions of the retina and putting it in different areas to see how that has an effect on the ability of a frog to perceive the world around it. So over here you can see the normal field of vision, where you have the grass on the ground, you have the fly flying up in the air. The retina in your eye, everything is upside down. It gets inverted, right? But those signals eventually make their way back towards the brainstem, and then eventually the tectum is what re-inverts everything back to its original orientation. Now, part of this really mean trick that they did with this poor frog was that they removed portions of the retina and just put them on the opposite side. So they rotated the retina of the frog. So basically, the frog is seeing the world upside down. And so when it sees a fly zooming past it, instead of the tongue trying to get the fly, the tongue is going to go in the opposite direction because the world is completely upside down. What a horrible experiment. I feel so bad for that frog. But anyways, that's associated with everything. Genes, chemoattractants, right? Trophic factors, all that stuff come into play with the ability for those cells to migrate. So in this case over here, concentration gradients are going to be established by, F receptors, right? As well as the efferent ligand, which is what binds into the F receptor. So different concentrations affect the migratory patterns of those different tracts. So don't commit any of this to memory. I'm not going to test you on any of this stuff, but at least on this chart. Man, that was quicker than I thought it was going to be. Let's go ahead and do the last quizzes. And then maybe just keep it open for discussion. Sound good? Yeah? All right. Awesome.
So basically this is not high yield since you skipped the
There's a couple things on here that are going to be on your exam. There's probably about 3 questions there. So know your your trophic factors. That's going to be really important. So All right. I didn't want to like blast you with a ton of questions on the exam from this section because I knew that we weren't gonna have like a lot of time to cover it. So I thought that would be unfair. So only a few questions on there. All right. That should be a softball question for you guys. Oh, it wasn't a softball question. So cell survival. Okay. Remember, what does tropism mean? What does tropic mean? Huh?
Expanding.
Like the guidance, right? Guidance towards a certain direction. That's what tropic signals mean. So a guide, so like chemoattractants, chemorepellents, those are tropic signals. They help to guide the direction of the developing axon. Trophic signals, that's what allows for the survival of the cell. Okay, so if you don't have neurotrophic factors, for example, the cells are not going to survive. Remember that whole like limb bud, they remove the limb bud from the embryo. The limb bud is what contains a lot of those trophic signals. If you don't have those trophic signals anymore, those neurons do not develop and they atrophy and basically wither away. Are we good on that? So that was a softball question. So cadherins, protocadherins allow for cell adhesion and calcium. A lot of these different processes are going to involve calcium as a mediator. Competitive interactions. Oh, whoops. Looking at the wrong question here. So neurexins, neuroligin, ephrin, and the F receptors. Those are all going to be parts of adhesion, right? So remember we talked about inductive factors that induce the synapse to form. We talked about adhesive factors and inductive factors. These are going to be allowing for adhesion, right? They induce and they allow for adhesion of the synapse. So these are not trophic factors. We're going to talk about, we already talked about them. There's 3 major trophic factors we talked about, right? One example is like BDNF, for example. There's NF, neurotrophic factor. So these are not trophic factors. These are adhesive factors. Good? Okay, I think this one was a nice softball question. So synaptic formation, you have competitive interactions, right? Competitive interactions, you're going to have the strong connections survive, and the weak ones are going to be pruned back. So that's what's going on over there. It's preemptive removal. So you're removing those super weak connections. All right. Easy breezy. The more dendrites you have, the more synaptic formation you can achieve. So here are your trophic factors, right? So these are what allow for cell survival, right? So you have nerve growth factor, NGF, brain-derived neurotrophic factor, and then you also have neurotrophin, or NF. So those are all really important for cell survival. So they bind to two major types of receptors. So you have your tyrosine kinase receptor. What's the other type that we talked about? It's the weaker one. It binds to all of these. Yeah, the P75. Good. So it's a weaker P75 receptor. It can do similar things, right? It allows for cell survival, neurite growth and all that, but also for apoptosis for the P75. So tyrosine kinase. That's going to be the major class of receptor. Structural homology. Structural homology means that you can get cross-activation, right? The receptors are different, but they're similar enough that you can have cross-activation with different ligands. So that's great. So remember with these signaling endosomes, once you have the BDNF or NF, any of those trophic factors bind to the tyrosine kinase receptor, they basically get engulfed, right, through endocytosis, basically, and then they get attached onto a microtubule and funneled all the way back to the cell body to allow for all sorts of different, downstream effects, protein synthesis, things like that, things necessary for the survival of the cell. All right. All the above, all this stuff happens with your neurotrophic factors. right? So whenever you activate your tyrosine kinase receptors using trophic factors, you get all that survival, growth, even plasticity. This should have been a softball question as well. So your Hox gene, super important for all these processes to happen, right? That's it. So let's go over what you need to know for the exam. Sound good? Let me stop this. Good job, Sasha. All right. So I'm thinking I just go through the exam and just kind of highlight the overall topics you need to be familiar with. So you had mentioned that should you know staining methods? Yeah, probably a good idea to know some of your staining methods. You know, I wouldn't necessarily bog yourself down too much by like differentiating between like the Crisell violet versus like the oh my gosh, Nissl stains. So yeah, you don't need to necessarily like try to differentiate between them. It can be a little hard to distinguish between those two, right? Especially Nissl stains you can see better if you like zoom closer, if you're looking at like the cell's 100x. But if you're looking like at a cross section of maybe like the spinal cord, it's gonna be really hard to distinguish between those two. But it's good to know staining techniques in general. In terms of like historical figures, again, know Golgi, Cajal. Tell me about meningitis. Yeah. So what are some of the things that cause meningitis? Yeah, that's great. What are the signs and symptoms of meningitis? Yeah, photophobia. Yeah, nuclear rigidity, right? Speaking of nuclear rigidity, what would be a couple tests you could do in a clinical setting that could help you kind of narrow down your focus? No, not quite. There's two tests. There's one where you have the patient laying on the back. There's one where you have them. Yeah, there's one where you have them flex their neck, right, and then they reflexively move their leg up. It causes pain. That's called the Brzezinski's test. What's the other test? Yeah, the Koenig's test. Good. So the Koenig's test, you have the patient flex their hip, right? And then you try to straighten out their leg, or straighten out their knee. And that's going to cause pain, and it's going to cause them to maybe like reflexively move their head. And so that's the Koenig's test. Okay, some stuff that we already just talked about recently. So I'm just like skimming through. Some of these are like softball stuff or things that we just talked about, so I don't want to rehatch that. Let's see here. What are some of the major neuroglia? Yeah. Microglia. Good. So, and then also ependymal cells. What do ependymal cells do? CSF production. Great. Right. Where's that going to take place? Yeah. Oh, geez, you're smart. Choroid plexus, ependymal cells, CSF production. Where does CSF get reintroduced back into the bloodstream? Oh, wait, you guys can look it up. I'll look it up. Look it up. So your sinuses, like the superior sagittal sinus, right? You have like a bunch of blood vessels in there, right? And then you have the granular villi, right, that basically are outpouchings of the subarachnoid space, right? So they're little outpouchings that get in contact with the venous circulation. So that's where you have drainage of CSF back into the blood. What happens if you have obstruction of the ability for CSF to get cleared out? Hydrocephalus, yeah, great, exactly. What's the way you can treat hydrocephalus? It's kind of, yeah, it's the tube. It involves a tube. It's called a peritoneal shunt. So you put in a tube basically into the ventricles, and then it shunts down into the peritoneum, and then it can get absorbed back into the body a lot easier. What do astrocytes do? Yeah, the blood-brain barrier. Great. So astrocytes are supporting cells that basically provide structure for the blood-brain barrier. What do microglia do? Yeah, they're basically like phagocytes. They basically go in there and they gobble things up. They're like the immune cells of the brain. What do oligodendrocytes do compared with Schwann cells? Good, yeah. And then Schwann cells is peripheral. Good. Probably should have made this exam harder. Let's talk about different types of neuroimaging modalities. So, what's the neuroimaging modality that gives you like really good detail of like soft tissues? It's either CT scan, it's either PET scan, it's either MRI or X-ray. MRI. So magnetic resonance imaging gives you way better resolution of soft tissues. CT scans are pretty good too. Like you can get a lot of detail with the CT scan. Not as good as an MRI, but you still get a lot of detail. Is MRI pretty safe? Yeah, it's super safe. What about CT scan? Is that super safe? No. Right, exactly. So it's going to provide lots of ionizing. It's going to administer a lot of ionizing radiation to the patient. What about ways that you can detect the way that your brain actually functions? fMRI is one. What's another one? What's the one that's really, really good? It gives you like awesome ability to like hone in terms of milliseconds what the brain is doing.
Is it the one that
MEG, you guys remember that? Magnetoencephalography. So magnetoencephalograms, those are going to give you really, really quick, like, millisecond detail of what's going on in the brain. It gives you functioning too. Like it actually shows which regions of the brain are functioning. So that's really, really good for like neuro research in terms of looking at which structures in the brain do what. fMRIs do basically the same thing too. You can see areas of the brain lighting up due to, I think it's oxygen consumption, which regions are taking up more oxygen due to high metabolic demand. And they're good too. You can see regions of the brain that correspond to different activity, but it's not, in terms of temporal detail, it's not as detailed. It's still really good though, but MEG is superior when it comes to temporal detail. What else here?
Is the MEG safe?
From my understanding, yeah. But let me look that up real quick. I don't see why it wouldn't be. Gotta be kidding me. Is my internet not working again? Really? How frustrating. Let's see here. Oh, there we go. MEG does not expose you to any radiation, so yes, it is safe. So just basically just magnets. Sorry about that. Okay, what else here? Again, know your embryogenesis. Know when you have gastrulation, you have those 3 different cell layers. Know which layer corresponds to the neural plate. Which one is that? Which layer? Huh? Okay, so no, in gastrulation, you have 3 layers. You have the endoderm, mesoderm, and ectoderm. Which one corresponds to the neural plate? The ectoderm. Which one corresponds to like the neural tube? Or sorry, the notochord? The mesoderm, good. Yeah, the mesoderm, notochord is basically the only thing that really comes out of the mesoderm in terms of like the nervous system. And then that basically provides structural support within the vertebral column, right? Your intervertebral discs, for example. What do neural crest cells do when they develop? That's going to be what forms the spinal cord? Good question. Spinal cord itself is formed by a specific structure. It's tube. Yeah, the neural tube. The neural tubes are forms of the spinal cord, as well as the brain too. Like the anterior portion of the neural tube will eventually turn into the brain. Neural crest cells turn into the peripheral nervous system, right? So they eventually become like your autonomic nervous system. What kind of, we talked about stem cells, right? What are the ones that are like the most controversial? We should all know that, right? And which ones are they? The ones that are kind of frowned upon? What kind of stem cells are the ones that are frowned upon? Yeah, embryonic stem cells are the ones that are going to be the most controversial. What's something that's cool nowadays that we're able to actually do? Embryonic stem cells. You have to kill an embryo to get the stem cells from an embryonic stem cell. What's the workaround?
You can like reverse.
Yeah, what's that called?
Starts with P.
So what's the term for a type of stem cell that can kind of basically turn into all 3 classes of... Yeah, pluripotent stem cell, perfect. And then you can induce that, and that's called an induced pluripotent stem cell, so iPSCs. So iPSCs are basically the workaround for the controversy involving embryonic stem cells. Now, this is something I was looking at the other day. One of my students in my patho class was like, can you use pluripotent stem cells to treat like a heart attack? And there's actually research going into that, where they can actually inject stem cells. And actually, I was talking to one of my colleagues, and he was saying, oh yeah, that the very first research that took place was here in Phoenix. This was years ago, like I think it was 10 years ago, 15 years ago or something. So they've been doing that kind of research for a while. The concern, though, is that if you inject induced pluripotent stem cells into a tissue, it could potentially turn cancerous. So that's one of the concerns. So they haven't really been doing this too much yet. It's still in the research phase because it could potentially lead to tumors. So that's one concern about stem cells in general, is that they could turn into any type of cell and they could basically circumvent the entire cell cycle. So that's one thing to keep in mind. Know which structures in the developing embryo's brain turns into what, right? So you have, so what are the 2 major categories? No, even before that. Yes. Prosencephalon, which turns into what? Telencephalon and the diencephalon. And then what's the other major category? Yes, good. And the rhomencephalon turns into what?
There's so many M's.
I know. So the mesencephalon is what turns into the midbrain, but that's separate. That's actually separate than the rhomencephalon. Rhomencephalon turns into the metencephalon and the myelencephalon. Metencephalon turns into what? Pons and the medulla. The mesencephalon is where you find the substantia nigra. in the midbrain. And then what does the myelencephalon turn into? And the myelencephalon, I like to think of it myelin. It sounds like myelination. Think about where you find like the tracts, right? It's like right before you get to the spinal cord, right? Myelencephalon turns into the medulla. And then if you were to be given an image of like the developing embryo, be able to see which parts correspond to what brain region and brain the derivatives of those brain regions. We talked about that. What's the condition that can happen if you are exposed to retinoic acid in the womb from mom?
I know it's where the kid grows a hair patch on their spinal.
No, that is different.
Like their brain only has one.
Yeah, basically you're not getting proper cell migration, and the skull, the bones in the skull and the face don't form properly. Hollow prosencephaly, right? And so that's going to affect which gene? Yes, good, exactly. The sonic hedgehog. Sonic hedgehog is going to be affected by the exposure to retinoic acid. And then what's the one that causes the neural tube defect that you were talking about? You got the hair tuft, spinal bifida. Yeah. What is it? What's causing that?
Folic acid.
Yeah, good. Which vitamin?
Vitamin B9.
Yeah, good. Vitamin B9. Awesome. Yeah, so vitamin B9 deficiency during embryogenesis, not a good situation. You're going to get a neural tube defect. Let's see here. So we talked about a couple of different mutations, other mutations. So DCX, what does that cause? I'll give you another hint. LIS1 also causes the same thing. LIS1. So you have an LIS1 gene mutation or a DCX gene mutation. What does it cause? What's the term for a smooth brain? Yeah, lissencephaly. Good. So LIS1, lissencephaly. DCX also causes lissencephaly if it's mutated. There's another one called relin, which we talked about. Relin is what basically allows for the proper formation of gyri and sulci. So you get, if you have a relin mutation, you can have weird looking gyri and sulci, as well as cognitive deficits. What else we got here? What's the whole purpose of the microtubules and actin when you have the growth cone?
Microtubules form the axons.
Yeah, they form the axon, so it's going to be important for during development. It's going to be important for what's it called? The tip of the axon when you're having formation of axon. Axon growth cone. Yeah, so the axon growth cone, right? So that's going to be microtubules, tubulin, actin filaments are going to be really important in the ability for the axon to fully develop. We already talked about that. We also talked about that. Oh, let's talk about different brain regions. So what's the brain region if you're filtering out unwanted, unnecessary information? Yes, good. What's the region when all of a sudden something happens and it's demanding your attention? Good, reticular formation. What's the brain region that's responsible for a lot of your innate type instinctual emotions and behaviors? Yeah, limbic system. What's the region of the limbic system that's associated with fear response? Amygdala. What's the region that's associated with memory formation? And the hippocampus. Good. What is? Let's see another one. What's the region of the brain that's associated with mirror neurons? The insula. Good. What's the region of the brain associated with motor function? Frontal lobe, specifically when you're actually having a true movement. Close, the prefrontal cortex. And that was gonna be my next question. Which region of the brain basically moderates the ability for you to either control voluntary versus involuntary movement? That's the basal ganglia. What about sensory input, sensory processing?
Thalamus.
Yeah, the postcentral gyrus. Good, within the parietal lobe. And then you said thalamus. What's the thalamus do?
I thought it was sensory processing.
It's kind of a relay center, right? So you have stuff coming to the thalamus from different sensory inputs or afferent signals, and then they get processed there. What's the one thing that doesn't get processed by the thalamus? Smell. Good. What's something that affects your temperature and other really important physiological functions? Hypothalamus. Good. Yeah. So if you're spiking a fever, that's going to be the hypothalamus. So thermal regulation. Also other things are controlled by the hypothalamus. Feeding, hunger, thirst, right? Aggression, a lot of that stuff also is going to take place in the hypothalamus plus the limbic system. Cranial nerves. What does cranial nerve 7 do? And what else? Taste. Good. To the anterior 2/3 of the tongue. What does cranial nerve 8 do? Yeah, vestibular cochlear nerve, right? So balance and hearing, right? So if you had a deficit of cranial nerve 8, what do you see?
You won't hear anything. Vertigo.
Vertigo, good. What would happen if you had damage to cranial nerve number 9? So yeah, you would lose taste to which part of the tongue? Posterior 1/3. You would also lose the ability for what? Yeah, for swallowing. You'd have an absent gag reflex as well. What about damage to cranial nerve 11? Good. What about damage to cranial nerve 3? Yeah, so you're going to affect your eye movement. What else? You're going to have, your pupils are going to be unable to constrict and dilate, and you're also going to have issues with your blinking. Right? You're not going to be able to move your eyelid. What about cranial nerve 5? If you damage that, you wouldn't be able to chew, and you wouldn't be able to feel your face. Great. Make sure you know your brainstem and what it looks like, where those cranial nerves live on the brainstem. So make sure you know that.
What was that diagnosis of facial pain? Was that with 5?
Oh, yeah, that's trigeminal neuralgia. That is cranial nerve 5. And trigeminal neuralgia, horrible. Like, you suicidal level amount of pain, right? Lots of people actually do kill themselves from that. So absolutely horrendous. Great question. I should have put a question in there on that.
I was thinking that there was going to be a question.
I did not. I should have. That would have been a really great question. Man.
Yeah, you should ask.
Put it for a bonus.
For a bonus. Okay, so let's see what else we got here. Yeah, so Bell's palsy, that's going to be basically peripheral lesion, right? It's outside of the brain. It's going to be a peripheral nerve lesion, and usually due to a viral infection, so it's post-viral. What part of the face does it affect? Does it affect just a quadrant or the entire?
Oh wait, Bell's palsy is
The entire side of the face, yeah. So if you had a stroke, you would only have, for the most part, you only have one quadrant being affected, lower quadrant. So you wouldn't be able to smile, right? Your one side would be paralyzed, but you would still be able to blink your eyes. So if you had the person smile and they gave you a crooked smile, but you asked them to blink, then you're like, oh damn, this person might be having a stroke, or lift their eyebrows. Whereas if they have complete paralysis, Usually you're not going to be worried, but you still want to get tested, right? You still want to get a CT scan just in case. It could be a stroke. All right, what about lesions to blood vessels? What is the term for when you have a hematoma that forms a lens type shape? And I'm not going to go any further than that. It's like a biconcave type lens. Epidural hematoma, good. What's another term for that? There's something syndrome. Talk and die syndrome, good. Which blood vessel is associated with that? It's an artery. Middle. Yes, middle meningeal artery, good. Now, what if you have like a crescent moon shape, right? It's slower progression. It takes longer for the symptoms to kick in. But when it does, it can cause like herniations, like uncal herniations, transtentorial herniations. It can be really deadly. What type of hematoma is that? Subdural. Good. What type of vessels are involved? Bridging veins. Man, you are smart. Okay, what's the most common type of stroke? Which blood vessel? Mm-mm. What happens if you do get a rupture of the circle of Willis? What's that called? That's the answer. It's a Berry aneurysm, right? But what's it called though? Subarachnoid hemorrhage. All right, good. You should be teaching this class. Subarachnoid hemorrhage. And what was the other question that we diverted from? What was it? Oh my gosh. Oh, the blood supply. What's the most common type of stroke? Which blood vessel is involved? It's catastrophic because it really provides blood to a lot of the brain. Middle. Which region of the brain is it going to? The cerebellum. So it's the middle cerebral artery. That's going to be the most common region where you have a stroke. And so what happens if you have a middle cerebral artery stroke? What's going to happen to your ability to move? Yeah, you get hemiparalysis. What about sensation? You get paresthesia. What about your ability to your ability to speak? You should be able to move your eyes. Yes. Yeah, you'd be able to move your eyes. So if you had locked-in syndrome, that would be a pontine damage. I didn't put any questions on the brainstem lesions like that. I should. I really wanted to, but I was running out of space. No, we're not doing spinal taps. So what would happen to your speech if you had a middle cerebral artery? What would happen to, what are the two major speech centers? Yeah, so where is Broca's area? Yeah, so it's going to be part of the frontal lobe, right? What about Wernicke's area? Posterior is part of the posterior temporal lobe, right? So what would those symptoms look like if you weren't able to, if Broca's area was affected, which is probably going to be affected by a middle cerebral artery stroke?
I feel like you just have noise coming out there now.
Because it's associated with motor function, production of speech, right? Motor production. So you're going to have blunted speech. I was just reading a book last night. Oh my gosh, what was his name? Tia. There was a person who had a stroke, and all he could say was like Tia. And so all of his friends started calling him Tia, because that's all he could say was Tia. It's like the Tono guy, the Tono, right? Tono dude can't say anything else because, except for numbers, remember? He was able to count. What about with Wernicke's aphasia? Are you going to be able to understand speech if you have Wernicke's aphasia? Right, yeah, because you're going to pretend you look like you understand, but you're not. You don't understand. You can understand, though, with Broca's aphasia, right? So that's great. Know your blood vessels. Know what happens when they get affected.
So Broca's you understand, but you can't say anything that makes sense back. Wernicke's you don't understand, but you're going to talk like you do.
You're going to talk like you do, but you're not going to make any sense.
The guy who's like saying a bunch of gibberish.
Yeah, it's all word salad. They don't understand what's being said to them, even though they look like it. Oh yeah, totally. And then just like go like hammering on with like a bunch of word salad. That doesn't make any sense. Yes.
For malfunction in the motor area, could you technically like give them a pencil paper and be able to write it?
Yeah, they could actually read and comprehend for the most part, and they could potentially write it out. Potentially. Don't quote me on that, but I think they could potentially write a little bit. Let me double check myself. They'll have difficulty writing, I guess. Severely reduced speech, often limited to short utterances of less than 4 words, limited vocabulary, clumsy formation of sounds, and difficulty writing, but the ability to read and understand speech. So I guess motor functions are also going to be involved in that too. I mean, it's the motor function or the motor production of words. So know your tracts. What's the anterior cortical spinal tract do? All right, what about lateral cortical spinal? Precise motor. Where does it decussate? Good. Where's the anterior decussate? At the spinal cord. What about the spinothalamic tracts? What's the dorsal column pathway do? Good. Yeah. So definitely know your different tracts: spinothalamic, cortical spinal. Know your rex lamina. Those 2 major ones that I had you guys pay attention to. It's super easy. You should be fine with that. That's it. That's it. That's all I have for you guys. That's going to be your first exam.
Nice.
Yeah.
It was a fun review.
Yeah. How do you guys feel about the exam? Do you feel like confident?
Better now.
Yeah? Okay, cool. Cool.